Today is bringing together a wide range of partners. We're looking at some of the things that are going on around the country. We've got colleagues here from NHS England, and the whole day is looking how we use data to support population health management.
It's about improving the health outcomes of the whole population, and it recognises that just acting at an individual level when people are ill and seeking care isn't just enough to improve our health outcomes at scale across. So population health refers to how do we work together across clinical and the non-clinical and the wider public sector to improve the health and well-being outcomes of Lancashire and South Cumbria.
Key messages today were getting to know the people you serve better. By getting to know them better, you're going to be able to provide better services, which is ultimately going to stop them getting sick and give you a healthier population. We want to use data to really understand how healthy people are, what sort of services they're accessing, how much they're costing the system, as well as what their experience is. You add that to new data sets that look at the broader determinants of health to give you a full picture of that individual and in turn the population.
The opportunity to improve the health of a population really does need to be done one person at a time, and I think the informatics has such a key underpinning to enable the success of that really advanced systems have not really managed to do that without the IT, but it's just an enabler. Everything else that has to change around it is more important and takes a lot more time. It's harder work.
If we think about integrated care being about how we use jointly allocated resource to get the best possible outcomes for a population, then the only way really we can do that is by understanding who our population is, understanding what their population health currently is and how we need to improve it, and therefore being able to use data to drive decision making in terms of getting the best possible interventions to maximise the impact.
So today we're talking about using variation in spend and outcomes to focus people's attention on areas that they could possibly do things better. Get everybody talking about the same thing, and then about what other things we can do to drive down spend, improve outcomes within the same resource. Comparing yourselves to similar 10 CCGs, whereby you can see we actually really are different. Speak to the best performing ones in that group, see what they're already doing differently, what can you learn. You don't have to reinvent the wheel, but that's sort of what we talked about today.
Talking about how building a social movement and working with our population really differently, having difficult conversations, holding space to really learn from, and then designing care with people who actually live with conditions. So for example, when we've been redesigning our work around diabetes, we've used what we call our population pentagon, and that means how do we prevent people getting diabetes in the first place? How do we detect it early enough to then be able to do something about it? If they get it, how do we protect them from it becoming a major problem? But then how do we manage the condition effectively, and then how do we help people recover from illness so they kind of go back around the cycle? And we're really working with people who live with diabetes to redesign our care, hearing some hard home truths, but then redesigning it along stuff that makes much better sense for patients and begins to tackle some of the health inequalities and health outcomes that we're seeing that need to be changed for the future.
We need to have a really true whole population approach. So we are thinking about people and their health and well-being all the time, irrespective of whether they turn up in our GP surgeries and in the hospital. But in order to do that, we need to be able to draw on a range of expertise, intelligence and analysts and clinical leadership, and being able to change the whole culture of how we work with each other at a senior leadership level